Good morning, everyone. We are back with another COVID-19 vaccines Q&A. My name is John Nelson. I'm with the communications team here at Nuvance Health. I'm honored to be joined today by Dr. Aparna Oltikar. Welcome, you're back. This is your second visit with us. Can you just reintroduce yourself, let everybody know who you are and why this is so important to you to be talking about this?
Sure. Well, thank you for having me back, John. It's a pleasure to be here. So, as John said, my name is Dr. Aparna Oltikar. I am the Vice President of Medical Affairs and the Chairman of the Department of Medicine at Danbury and New Milford Hospital. So, you know, I oversee a lot of the clinical operations at these two hospitals. And I am here to talk to you all about vaccines because over the past year, I've really sort of been in the thick of our COVID response, and I've seen what COVID can do to people, to families, to futures. And, it's just made it all that much more important for me to talk to people about how, the only way to prevent from being in that position is to get vaccinated. So anything we can do to help people resolve their questions, their doubts about why the vaccine is something that should be taken on, I'm happy to participate in.
So glad to have you. This week, we thought we'd talk a little bit about, we all have family, we all have friends who are, hesitant, but maybe even we know a few people who might even oppose, like be against vaccinations. And, so we want to get into that subject a little bit, but I think the first thing that we should really just talk about is the exciting news that came out this week, which is, the CDC has kind of, changed some of its masking guidelines for people who have been vaccinated. I'll throw some of these out there, and obviously we want to, we want everybody to still, practice the safety precautions and all those other things. But I'm just going to say a few of the things that the CDC has said for fully vaccinated people, and this is one way to get encouraged to get vaccinated, right? So, outdoor activities, when you walk, run, or bike outdoors with members of your household, you can be without your mask. Attend small outdoor gatherings with fully vaccinated family and friends. Attend small outdoor gatherings with fully vaccinated and unvaccinated people. Doesn't necessarily have to be family and friends. Dine in an outdoor restaurant with friends from multiple households. So what do you think about these recommendations? Is this good news for everyone, Dr. Oltikar?
Yeah, I think it is really great news because I think for all of us, who've gone through this past year, we've all kind of been waiting for that day when we can start living what we consider more normal lives, where we don't have to have these masks, where we can spend time outdoors, exercising, enjoying the beautiful New England weather. So this recommendation from the CDC yesterday was great. And I think I personally am looking forward to taking a walk with my dog outside without a mask on. So I think that this is just one more reason why people should get vaccinated, because when you do, you're going to be able to lead a more normal life, get back to the old ways.
That's right. And one thing that was made very apparent there, though, is even though those are options, for outdoors, they do recommend that people still wear your masks if you're attending a crowded outdoor event, like a live performance, a parade, a sports event, a concert, or something like that. So
absolutely.
Yeah. So
if you're going to be with a bunch of strangers or, a lot of people where it's really impossible to maintain that 6 feet of social distance, and there are people who are not in your household, then you really do want to continue masking.
Right. So that's great news. But we wanted to talk a little bit today about, people who are still hesitant, but there's also a lot of news out there about people who are just kind of oppose getting vaccinated, which is, acceptable. It's a free country, all those other fun things. But people being opposed to vaccines isn't necessarily new to COVID-19, right? It's been around for a lot of other vaccines, right?
For sure. When I was a primary care doctor many, many years ago, I remember a lot of my patients saying, they didn't believe in vaccines. They didn't want to get vaccines. They believed that vaccines caused autism, et cetera, et cetera. There's a lot of mythology out there about vaccines and their and how they work inside of the body. So you're absolutely right. This is not unique. This hesitancy is not unique to COVID-19 vaccines. I think it's just become more magnified in the COVID-19 situation, given how important it is for us to get all of us to get vaccinated. And then I think some of that is amplified by the fact that these vaccines are new, their approval was accelerated. So there's a lot of hesitancy related to that
Okay.
as well.
And I remember just in the news a few years ago, I'm like, you've always heard like people who don't want to get the flu vaccine or other things, but I remember in the news, if you and maybe you remember this too, but like about like whooping cough or measles and how people not getting vaccinated, those are one of the reasons that those illnesses have the opportunity to come back, correct?
Right, absolutely. And, I think to your point, I think because there is a subset of people who don't get the routine, say, childhood vaccinations, the primary vaccination series, we have seen a recrudescence of illnesses that we thought we had really kind of taken care of, things like measles, mumps, and rubella. And so that is the danger of not taking the vaccine for things that we have vaccines available for.
Right. And that just is the macro. And now we're talking about the micro, which is the COVID-19 vaccine. And so a lot of questions that come up all the time. And these, I'm going to ask you a few of these. One of the ones that I hear a lot is about the mRNA vaccines, which is the Pfizer and the Moderna. And like people saying like, no, I don't want to take that vaccine because it changes your DNA. Is that correct? Or like, what can you say about that?
Yeah, so that is not correct, John. What happens with these messenger RNA vaccines, and as you pointed out, that's the Pfizer and the Moderna vaccines, both employ that technology. So what happens is they take a little piece of messenger RNA from the COVID virus. It's the piece of mRNA. Messenger RNA is the instructions for how to build certain proteins. And so what they do is they take the messenger RNA from the coronavirus that tells the body how to build the spike protein, which is felt to be a very key part of how the virus causes disease. It's pathogenesis. And so that little piece of messenger RNA is suspended in a small droplet of fat and injected into the body. That messenger RNA then uses the cells in our own body to produce the protein. But to do that, it does not ever intercalate or integrate into our own DNA. So there is no, the mRNA does not get into our own DNA.
Okay, and that's important, and it's important for anyone listening here to, if you hear someone say that, like make sure that you communicate the science, because there's a lot of misinformation out there, and it's our mission. We want to fight this hesitancy, and you fight it with the facts. I mean, that's what you do. So another question that comes up a lot is, some people will ask, they'll say, is immunity from vaccination stronger than natural immunity? So like, is it better for me to just get COVID and get natural immunity than to get vaccinated? So what do you say to that one?
So I would say that natural immunity and vaccine-induced immunity are probably relatively equal. But insofar as saying, oh, well, I'll just go get COVID, the problem with that strategy, John, is that COVID is a very mixed bag, right? And I think that currently there are a lot of younger people who are probably not vaccinated. And what I've heard a lot of is, oh, well, I'm young. And so even if I get COVID, I will probably not get a very serious infection. And while statistically that is true, the reality is that I have seen personally plenty of young, healthy people without any comorbidities get COVID and get severely ill and even die from COVID. So if we're talking about risks, right, we talk about risks of vaccines all the times. It's the risk of the vaccine versus the risk of COVID. And I think that the risk of vaccine, yes, it's not zero. It's very hard in the real world to ever mitigate risk completely, but that risk we know is very, very, very small, even with some of the vaccines that more recently have been in the press. Whereas the risk of COVID, it's not that small. I mean, there are plenty. I think if you were to look across the country, across the world, there are plenty of young people, people who don't have some of the traditional risk factors that we associate with more severe COVID, who get severe COVID and who die from it.
Right. So it's that risk benefit thing. You know, you think about the risks of getting the vaccine and you think about the risks of getting COVID, but you also think about the benefits of what the vaccine can offer you. And, you know, obviously there aren't a lot of benefits to getting COVID.
No.
So, and I don't mean to laugh at that. It's not a funny thing, but it's
no, it is
it's
not.
just not benefits to that. So one person has asked us a question on Facebook Live, and I think it's a good question to answer right now, because we've been reading a lot in the news lately that there are a lot of people out there who are getting the Pfizer or Moderna first doses, and then they're skipping the second dose. They're just saying, yeah, I've gotten one dose, that's enough. So how much protection do you have after the first dose of like Pfizer or Moderna? Why is it so important to get that second dose?
So, you know, I think that the data, and I don't have the data immediately at my fingertips, so this is somewhat generalized data, but I think that in general, the efficacy of the vaccine, for whether you're talking about Moderna or Pfizer, after the first dose is probably somewhere in the range of 50%. So, you know, not terrible, but not great. Whereas we know that 2 weeks after the second dose of either the Moderna or the Pfizer, which is what we consider someone to be fully vaccinated 2 weeks after their second dose, the efficacy of the vaccine is 95%. So who wouldn't want those odds, right? I mean, so if I'm out there and now I'm going to possibly take the opportunity to be out there jogging or exercising or doing things outside without my mask, I would feel much more comfortable doing those things if I knew that I had a 95% chance of being protected against COVID versus just a 50% chance. So that's why it's so important to get that second shot, because you're just doing yourself a favor. You're increasing the likelihood of being protected against COVID.
Right, and everyone wants better odds, right? So
Everyone wants better odds.
Better odds. Let's get the better odds. So someone else asks about herd immunity, and they want to know, and I don't know if we know the answer to this or not, but how can herd immunity take effect if there's no immunity with a COVID vaccine, as a person can still spread the disease? So they want to know, like, you know, I don't know. Does that make sense to you? Or
yeah. So I mean, I guess the question is, can people who have been fully vaccinated still acquire subclinical or asymptomatic COVID and then spread it without really knowing? And the data that I've looked at recently, John, is that that risk is very, very low. That patients who have been fully vaccinated with COVID likely cannot transmit the disease. They just don't have enough what we call viral shedding to be transmitters of the disease. So we think that COVID vaccination not only protects you against developing severe or dying from COVID, but it also protects others, because even if you were to be exposed to somebody with COVID and acquire COVID, the level of viral shedding that you're going to now have is probably not in the transmissible range.
And it also makes it, you know, with less prevalence, it decreases the chances of more variants. Isn't that correct? Is that so? The less disease out there, the less opportunity it is to mutate, right?
Absolutely, absolutely. So, you know, when there's a lot of virus out there, it's very rapid. You know, all viruses mutate. All viruses mutate fairly rapidly, given how short the replicative cycle of a virus is. And so, the more replicative cycles, the more opportunities that virus has to replicate, the more likely things are going to go wrong and variants are going to develop. And then it's almost you know, necessary that there will then emerge some variants like the B.1.1.7 variant or the South African variant, which are more transmissible or more pathogenic.
Mhm. Okay. One of the other, like, I don't want to say it's opposition, but it's more misinformation, but like a lot of people, and some people think it's because they named it Operation Warp Speed, but you know, some people get out there and they'll say that the clinical trials like skip steps because they wanted to move it really fast, but that's not really true, right? I mean, the system worked really well with clinical trials, correct?
Yeah. I mean, my assessment is that the system really worked, and that the reason that it normally takes us, so much longer to get from something in the lab to the FDA to approved and in people's arms is that it's not usually the singular focus of what we're doing, right? I mean, we're all doing a variety of different things, and that is just one of various things. So every step isn't condensed into this very tight timeline. Whereas with the COVID vaccine, I can tell you that as somebody who oversees a hospital, helps oversee a hospital, during the first and second surges, we did nothing really other than focus on COVID. It was all COVID all the
Mhm.
time, uh, uh, 24/7, the whole
Yeah.
time. And I think that that's how it was with the people who were involved with vaccine development, that they stopped doing all of their other projects and singularly focused on bringing to market a safe and effective COVID vaccination. And we are incredibly fortunate that we have not only one, but many viable COVID vaccinations out there. So I think that the safety, that the process was followed. It was just very condensed. So we didn't skip any steps. We just made the steps all happen sequentially very close to each other so that
Mhm.
they could happen over a very short period of time. And I think that anybody who is concerned about how is the safety of these vaccines being evaluated as we go forward, I think the recent pause that we took related to the Johnson & Johnson vaccine is actually a testament to the fact that we do have a very safe process, that as
Mhm.
soon as we picked up a signal that maybe there was a higher incidence of some, fairly rare kinds of blood clots in patients receiving the Johnson & Johnson vaccine, we at the national level put a pause, looked at the data more closely, and only after, sort of reconvening, reevaluating the data, were we even willing to say, you know what? Yes, the signal is there, but the numbers are so extraordinarily small that we feel comfortable, moving forward.
Right. So the system works, which is, I mean, that's a great message. And, I actually have a friend who was talking to me the other day about side effects. And she said that she didn't want to get vaccinated because she doesn't think that, she hears from people who say they had a really bad side effects, and then they'll talk to someone else who said that they didn't have any side effects.
Right.
And they're like, well, that means to me that it doesn't work in everybody. So is that really the case? If someone doesn't get side effects, is the vaccine not working?
No, I think that each of us respond to a host of different things in very different ways, right? So two people could be exposed to the same person with a bad cold, and one of them will get a very minor cold or not at all, and the other one will get super sick from that cold. And so each of our immune systems is a very individual and nuanced thing. And so some of us, mount a very exuberant immune response, whereas others of us are less so. But the end result is the same.
Okay.
The end result is the same.
And so another argument that you hear, and I keep saying argument, it's not really argument, it's just you'll hear people say, well, I got COVID. I had COVID, so why should I get vaccinated? I don't need to get vaccinated. I've already had the disease. You still should get vaccinated though, right?
You should. So the current CDC guidelines for people who have gotten COVID is that after 10 days of recovering from COVID, after 10 days of your initial infection, you can go ahead and get vaccinated. And the reason to get vaccinated is that we don't know how long the immunity lasts after active infection. In fact, we don't know how long the immunity lasts after vaccination, which is why currently the prevailing thinking in the scientific community, in the medical community, is that we're all, just like with the flu shot, we're going to need booster shots of COVID vaccination, possibly even on a yearly basis or more frequently, depending on what the data shows, to address the fact that immunity wanes over time, and also to address the variants, because just like the flu, which changes every year, and so the flu vaccine needs to be reconstituted every year to address the predominant strains that are predicted to be happening
Right.
that flu season. It'll probably be very similar with the COVID vaccination.
We have another question on Facebook Live, which is great. Thank you everyone for watching. Again, I'm John Nelson with the communications team at Nuvance Health. I'm with Dr. Oltikar. And someone says, what do I say to friends who feel that there is science that is not widely shared that says this is not a vaccine, it's an experiment, and that there are people who should not get it with other medical conditions?
So currently there are, so I would say that I have not seen that science. I'm a fairly rigorous scientist myself, and read the medical literature quite avidly. I think it's important for the work I do. So if there is rigorous science saying that, I have not personally seen it in the journals that I read. So I would question, if I were that person, I would say I'd like to question where you're getting that data from, because we know that not all sources are the same. And in this current world of a 24-hour news cycle, social media, access on the internet, it's very easy for small bits of misinformation to rapidly, circulate through groups of people, and to sort of acquire this aura of, oh, this is dogma or this is solid. But the fact of the matter is, until you really dig down deep and say, well, where did that data come from? Because I haven't seen it in some of the most reputable journals, like the New England Journal of Medicine, the Annals of Medicine, and that's really should be our sources, because those are the gold standard journals in the medical academic community.
Right, and that's it. Like always, we always should question. We always should do our research. We always, if someone comes to you with something that just doesn't sound right, tell them to check their sources. Tell them to ask questions. To talk to their doctor or anything like that. We do have a nice comment from someone who says it's really amazing that last year we were able to get these vaccines approved or authorized, emergency authorized, and plans in place to distribute them so quickly. And they just comment that otherwise this pandemic would be going on for a long time beyond this. So I think that's an important message. And we want this pandemic to end. That's why we need people to get vaccinated, right?
Absolutely. And we're really close. We're really, really close. I think the most recent data that I've seen is that almost 50% of Americans, 140 million people across the country, have gotten at least one dose of the vaccine. And so we are getting, and now the CDC is restricting is taking away some restrictions for vaccinated people. So I think this is a very, very hopeful place. And I think that if we can just get more people, that last bit of people, to get on board, to understand and believe the science, to trust their doctors, then we will really be able to start looking at this pandemic in the rearview mirror.
Yeah, I love hearing that. And I love hearing that from you. So it makes me smile that the sun's out and we all hopefully can all go out and start enjoying that sun. One of the questions that is just predominant, and it has to do with pregnancy and breastfeeding. You hear that a lot from, I've read stories about it. I've heard on the news. Some people say that, or some women say that they don't want to get vaccinated because they are either pregnant or want to get pregnant, or they're breastfeeding. Do you have anything to say to someone who might question getting vaccinated?
Sure. So, I think that for women who are either hoping to become pregnant or who are pregnant, the question of putting something in your body is always a paramount concern, and that's a very legitimate concern, John. So I don't discount that in any way. But there is some recent data. I think the study has been done using the Pfizer vaccine, looking at the safety of the Pfizer vaccine amongst pregnant women, and the data shows that it's very, very safe in pregnancy. And then I also looked at some other recent data that I think was published in the New England Journal, that pregnant women who contract COVID have far greater chances of having complicated pregnancies, poorer outcomes, where the child may have issues. So, I think that, again, the preponderance of data that we have currently is indicating that these vaccines are safe during pregnancy and probably actually protect you against something that may actually make your outcome worse.
And so I guess kind of the question, and you've touched on this a little bit, but how are we going to know how well the vaccines are working? Like ultimately, like we see the numbers going down, and we believe that this is because of the vaccines, but how are we going to know how well they are working and that the pandemic is on its way out?
Well, I think that one is just looking at our numbers overall, right? I think the numbers currently show a 21% decrease in total new cases of COVID in the United States. And yeah, there may be a seasonal component to that, absolutely. But the one big intervention that we have made is vaccination. So it would be very hard for me to see how those two things could not be linked. Mm-hmm. And number two is going to be, so I think that if we were to start seeing those numbers start to turn the other way, then the scientific community would be concerned and saying, maybe immunity is waning, maybe it's time for a booster, maybe there are variants that are no longer protected by the vaccine. So I think that the main indicator is going to be just what are our numbers doing on a day-to-day basis. And then, also understand that the COVID vaccine trials that were started, 6-7 months ago, they're still underway. Mm-hmm. And so I'm sure that as part of those trials, they are measuring antibody titers in the people who, in the cohort of people who got vaccinated. And we will see that data, probably within the next several months to say, are we starting to see those titers in the vaccine trials come down? Because then if so, we can extrapolate that to the larger population.
Well, Dr. Oltikar, I literally could talk about vaccines with you all day. I just love asking you questions and hearing your answers. And I hope that we've been able to, at least make some of our folks out there who are maybe a little hesitant, maybe listen or question, or, maybe just inch a little bit more toward getting vaccinated. We do have a question about, what's the data on the percentage of our population that's been vaccinated? We know that in the country, I think over half of our population have had at least one dose. When it comes to Connecticut, New York, I think you'd have to, go to your state websites and look up the latest data. They will have it, but we can say that, right now, the supply of vaccine is starting to exceed the demand. So, there are options out there for you to get vaccinated. Go to your state website.
Absolutely.
Go to vaccinefinder.org. Go to your county website. Go to newvancehealth.org. There are options out there for you to get vaccinated if you're if you're of the right age and you want it. So we just encourage you. Any final messages for everyone, Dr. Oltikar?
No, I thank you all for listening, and I hope that we've been able to maybe change even one person's mind about the vaccine, because that's what it's really going to take is, changing people's hearts and minds, getting them to take vaccines so that we can all get back to life and to the things we love.
Thank you so much. Have a wonderful day, everyone.
All right. Thank you.